The Philippine Nurses Association of Nevada now brings you Filipinars, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Hello, all you Filipinars listeners and followers. How are you doing? It is time again for that weekly broadcast of our Filipinars. This is your host, Doris Bauer, president of the PNANV, or the Philippine Nurses Association of Nevada, and your host for this broadcast. This, of course, is going to be brought to you by PHLV Radio. Well, this week we have a special thing going on around here in Las Vegas. And it is actually the 2019 Nevada Health Conference is being held here at the Renaissance Hotel here in Las Vegas. And the event is hosted by the organization called Immunize Nevada. The conference brings together Nevada healthcare professionals to talk about immunizations, disease prevention, and health issues. And this year's keynote speaker will be addressing surviving meningococcal disease, otherwise known as meningitis. Okay, so just a little tidbit. Bacterial meningitis is the most serious type of meningitis. It can lead to death or permanent disability and can be very deadly. Death can occur in as little as a few hours. And meningitis vaccines actually protect against meningococcal disease. Vaccination is something that you can do to protect you and your family from meningitis. So let's learn all about that today. We have guests today here to talk about the importance of meningitis vaccinations, and our special guest who will be sharing her story in surviving meningitis. So please welcome Ms. Jamie Shanbaum.
Yes, hi.
And Ms. Brianne Van Dyke.
Hi there, thanks for having us.
Oh, thank you. We are honored that you invited us actually to do this interview. So I'm going to start a little bit with Ms. Brianne. Brianne is the Education Director of Immunize Nevada. Brianne, can you say something about yourself?
Sure. I'm the Education Manager for Immunize Nevada. I've been there for just over a year now, but previous to that I worked for the Nevada State Immunization Program as their Adolescent Immunization Coordinator. So meningococcal vaccine, being that it's a vaccine that you receive within adolescence, is a cause especially close to my heart and to the cause of Immunize Nevada.
Okay, well, thank you. Thank you for coming. And our special guest speaker and the keynote speaker of this year's Nevada Health Conference is Ms. Jamie Shanbaum.
Yes.
Okay. Jamie's a para-athlete and is a member of the U.S. Paralympic cycling team, and she is our meningitis survivor. Jamie is also a GSK spokesperson and is very focused on raising awareness for meningococcal disease and the two vaccines that need to protect our young people. So welcome, Jamie.
Yes, thank you. I'm so excited to be here, and it's so important just to share the story, and so thank you for letting me share with your audience. I appreciate that.
Of course. Is there anything you want to add about your info?
Yeah, I mean, I'm 31 right now, and I'm from Austin, Texas, and it's been a pleasure just to share my story on so many different platforms because a lot of people don't know about this disease, and I think that's a really big issue about it. And just people aren't aware of how potentially devastating it can be. So
Absolutely.
just here to educate if I can.
Thank you. Welcome to Las Vegas.
Yes.
This your first time?
No, it's my third.
Oh, okay.
And I hope to come back many more.
Okay. All right. So you still live in Texas then, and you're from there?
Yes.
Okay.
I'm from Austin, Texas, and I still live there, and I love it.
The capital, right?
Yes.
Yeah. Okay. All right. So can you please share with us how you contracted meningitis?
So that's the thing about meningitis. You don't really know where or when you have contracted this disease because you could be carrying it for a while. Mm-hmm. And so for myself, and I can speak on my experience, I got sick in November of 2008, and my symptoms were early on flu-like. And within 14 hours of my first symptom to being admitted into the hospital, I was incapable of walking. I couldn't retain any warmth. I was breaking down, but I didn't have the significant signs of meningitis where you can't touch your chin to your chest, and I didn't have the petechiae rash yet. So I was very lucky that there was a nurse there that properly guessed and assumed it was meningitis, so they were able to put me on dialysis immediately
Wow.
and antibiotics. So I was very lucky.
Immediately dialysis, huh? Wow, that's okay.
Yeah, so it was very scary. I mean, imagine being the age of 20 and you're excited about going to college. And this was my second year at college, but my first year at this big university. And at this university, there's about 55,000 kids in undergrad. And I lived off campus and still got this disease. It's more common in dorms just because of our social behaviors. And I know that y'all can touch on this being medical professionals of how you can spread it, but so being in college, it was unbeknownst to me that I was at a high risk of catching this, and I almost died from this disease. I had a 20% chance of survival and ended up being in the hospital for about 7 months.
7 months.
Yeah, so
wow.
it was hard, very more easily said than done. It was very difficult. You know, when you think about, oh, she has meningitis, like, what does that really mean? So for me, it meant that I was half alive and half dead. My limbs have decayed. They became necrotic tissue, and my fingers were shriveled up. My feet were curling out, and it's not like I'm up on my phone like texting people. I felt like a statue in bed. I could not move. That was the normal life in the hospital. Every day, bedside wound care, examining, trying to do physical therapy. That was impossible because I felt like a statue and they were trying to move me and I could not move. And I had tubes in my mouth, so I couldn't talk either to express what I need or did not need. I was so dependent on people to the point where I couldn't press a button to call my nurse. I had a contraption above my mouth that I could blow into.
Really?
That's how limited I was.
Wow.
So, and it was like that for the remainder of my experience. I mean, leading up to leaving the hospital, I was finally sitting up on my own. That's how much it took out of me. So imagine being in a bed, laying down for 7 months. My muscles atrophied. My protein levels went down. I lost most of my hair. And by the time I left, I was 80 pounds. But I also had limbs missing. So there's a big weight difference there, too.
So when did they decide to do amputation?
So within 3 months, they decided to do amputations. My mother, when we were first in the ER and we were in isolation for sure, they were thinking that they were going to amputate at my forearms and above my knees. And luckily, my mom is very stubborn and would not allow it. And and luckily, Facebook was around at this time, and we reached out to our network and see if we knew any great intravascular disease doctors. And we found one in Houston that would take our case, so I was transferred there. And I had hyperbaric treatments, and I had about 50 dives, as they call them, treatments. And it really proved to be beneficial because they were able to rejuvenate my limbs by providing oxygen with the treatments. And that's why I was able to possibly save as much limbs as I did. And I like having opposable thumbs, so it works out. I like being able to pick things up and make it a little bit easier. So, but yeah, it was a long road of recovery, and I was able to eventually figure out how to use my new hands because not only do we utilize it, but it's also a form of expression if you talk with your hands, I guess. So I was learning a lot about my new life, and it is a definition of a life-changing event. Meningitis can be a life-changing event, and for me it was. And I just want to educate people about it because I didn't know anything about this disease. Could you imagine going through all of this, learning about it, learning that it could have been prevented?
Yes.
Is a tough pill to swallow.
And that's what I was going to. When did you learn, or how did you learn that all this could have been prevented because of non-vaccination? Did you receive a vaccine for meningitis, or you did not?
No, and we weren't anyone that was like vaccine hesitant at all. We were just we just did not know. if we did know, we would have been proactive and protected ourselves. And because of just not being aware and no one brought it to our attention, I suffered because of it, I guess.
Yeah.
So
Wow.
happy to be on the other side, I guess.
Well, that's good. So you had a lot of nutritional issues. You had your limbs, amputated, and it must have been difficult to, realize that your life was basically changing. I'm sure it had some mental issues as well,
Yeah.
depression possibly.
Yes. And
Right.
honestly, surprisingly, I didn't get depressed until towards the end of my hospital stay. You'd think that would be like immediately. But I think I just got so frustrated because when I thought I was getting my amputations, I thought that means I'm finally going to get out of here sooner.
Yeah.
But when I got out, I was at my 3-month mark, and I still had 4 more months in my hospital stay. So yeah, I got depressed.
Yeah. We know that you're also a para-athlete. Okay. So can you tell us the story about that and how you got into the United States U.S. Paralympic cycling
Yes.
team?
Yes, so that was very surprising even to this day. I'm surprised. So when I was in the hospital, I wasn't really thinking about getting on my bike again because in Austin, it's a big bike-friendly town.
Yeah,
Every day I
yeah.
bike to school.
Wow.
And I wasn't thinking about that. I was thinking, how am I going to meet people? That's how much limit I felt like my potential was.
Of course. Yeah.
And that's really unfortunate that I ever thought like that because people who face challenges have full leading lives. So I don't know why I was in denial. But anyways, there was this man. He was my occupational therapist, and he had one arm missing. I think that's impressive as an OT, excuse me.
Yeah.
And he was excited that I was a person who was interested in cycling, but I was also 80 pounds. And this guy is hyping me up about cycling again. And I didn't know who this guy was, and I was like, get him out of my room, please. And then he was right. We did talk about it, and then he got me on a recumbent bike, which is like those sit back and then you kind of kick. And then we got on a power assist bike where I don't pedal at all, and a button makes me go forward. And then we did the real deal, and it was very amazing. I wasn't like a pro at it. It was very dad and child sort of training on a bike where they're holding the bike and I'm on the bike and then like we're running together and he pushes me. So it was very dad-child moment. But yeah, it was astonishing that it actually happened, and it's still astonishing that I'm still able to get on my bike at any time. So after about 4 bike rides, I found myself in the Live Strong Challenge in Austin, Texas in 2009, around October.
Wow.
And 2010. And it was amazing. I did 12 miles. That was my first like official ride I've ever done. And my cheeks were hurting instantly from smiling so much because I was potentially on my deathbed 2 years prior. So it was amazing that I was able to come that far at that point. So a couple bike rides later, I was meeting someone at an event, and he's asking me questions about my bike and how it's adapted. And to answer that, so my brakes, because you use your fingers to brake on your handlebars, they're flipped onto my side of the handlebars, and I push into them. And that's the only difference. And he's asking me this because he's a U.S. Paralympic cycling coach, and he's wondering how I would qualify on the team. And so he asked me to go to U.S. Road Nationals where I would compete and then qualify for a certain category. And I did, and competed and won in my category. So it was really amazing. That was also 12 miles. And that was, at that point, that was the most official event I've ever been to. Because this is the event that gets you in certain categories or on the team. And so everyone's out there showing their A game. So many sponsorships out there. ESPN media, and you also get to see regular able-bodied people and the people with their challenges biking. So it was really cool just to see all of that in full form. But then he asked me to be on the U.S. Paralympic cycling team about a couple months later, and I found myself in LA in 2011.
Wow.
Around September, I think.
Yeah.
And was training with the team. I was meeting my teammates, and it was like a big swag bag of like U.S. apparel, and I still have all my jerseys and all that
That's
stuff.
fantastic.
So it was really cool
Yeah.
just to be on the team and to like see a whole other world. Yes, meningitis is life-changing, but being on a team is a lifestyle event that you have to change completely. From everything, the obvious things of eating and your sleeping regimens, but also your practicing and your recovery time and being with the team and make sure you have matching team outfits. It was a lot.
Yes.
But it was great.
Yeah.
I competed at the U.S. Pan American Games in Guadalajara.
Oh.
I did 4 events. I didn't medal in anything, but I did hit all personal records in
But
each
you were there.
event. Yes,
There
and
you
it
go.
was great. But at the same time, I was still in school, so it was a lot on my plate at the same time. But happy to have done it.
Yeah, well, that's very, very inspiring. Actually, my son bikes, so he's gonna have to listen to this podcast. And we have a big cycling Nevada bicycle club here
Oh, wow.
in Nevada as well.
This would
I'm
be a
not
great
sure
place.
about the Paralympic situation here or clubs anywhere, so we'll have to figure that one out. Okay, that's fantastic. Great story, great story. So can I ask you, how did you become an advocate for immunization?
Just through the instant moment of realizing that, this could have been prevented. And, you just want to advocate for people about it. But yeah, we started a nonprofit organization called the Jamie Group. And we're grassroots, it's just me and my mom mainly.
Yeah.
But we try to educate anyone that's willing to ask us to come and present to them. And also we pull out educational tools to anyone who needs it and go to clinics and try to maybe help diagnose because my symptoms weren't obvious. So I try to let them realize about the differences in that.
Okay.
But also to let them push on educating each patient that goes into there, because each patient deserves to have this information.
Right. And the Jamie Group, that is short for Joint Advocacy of Meningococcal Information and Education.
Yes.
That's fantastic.
Yeah, it worked out.
Okay, that's great. But you were actually instrumental. Your case was instrumental in the 2009 meningitis vaccine law passed in Texas.
Yes.
About this, and it's called the
Jamie Shambama.
Jamie Shambama Act.
Yes. So that was back in 2009.
2009. So at the time, there wasn't really a meningitis vaccine act in
At the time,
Texas?
there were no laws in the United States that had meningitis vaccines. And for college students, so we were the first ones to be pushing for that. So it's nice to see so many other states to also be pushing for it too.
That's
But there were, as I mentioned earlier, I lived off campus. And, when you get meningitis, it's more prone for people who are in dorms just because of social behaviors. So how do you get meningitis? Do you want to add as a medical professional versus my own take?
Yeah. Well, that's going to be the medical thing that's probably a different podcast on its own. We want to hear your story, but we can probably ask Brianna over here. So let me direct this question to you, Brianne. You're hosting this year's Nevada Health Conference. What is Immunize Nevada and what is its mission?
We are hosting. This is the 2019 conference. Our mission at Immunize Nevada is we're a 501c3 nonprofit, so we work closely with various community partners throughout the state as a coalition to boost education and outreach surrounding immunization and vaccines. So that includes both for medical professionals, those working in the public health arena, and then also just the general public who has questions or concerns about vaccines. We're out there answering questions daily and at outreach events, and then providing and organizing coordinated efforts for provider education as well.
Okay. So can you speak about meningitis, and from a meningitis standpoint, where is Nevada with regards to the vaccines that are actually recommended to get for our young people?
So Nevada follows the ACIP recommendations that are adopted by the CDC, so the Centers for Disease Control and Prevention, across the board. But as far as school requirements go, Nevada requires ACWY, so the meningococcal conjugate vaccine, the first dose to be administered prior to a student starting their 7th grade year. So that's the first dose in a 2-dose series. So the hope is that maybe further down the line, we would be able to work with our state legislation to hopefully get that second dose required for school as well. So that's where we're at as far as school requirements for meningococcal vaccine.
Okay. All right. Well, you guys are in Reno, right?
We're a statewide coalition.
Coalition.
We have a office up in Reno and then an office down here in Vegas as well. And then we work with our various rural partners throughout the state too to make sure that they're getting adequate access and education surrounding vaccines as well.
Okay. All right. Well, can you talk a little bit about what Jamie was saying? You know, what are the symptoms? How would you contract meningitis and all that? Or
sure. So Jamie had talked a little bit about her symptoms not being so obvious. So there's kind of those big 3 symptoms that they talk about concerning meningococcal infection. So that would be the nausea, vomiting, and confusion. Sometimes fever is associated with that a lot of the times. And then as far as transmitting the disease, it is very rare, but it's transmitted through respiratory droplets. So that would be, as far as in addition to vaccinating, the way that you would prevent exchanging the disease would be not sharing water bottles,
chopstick, cigarettes.
Yeah, exactly.
These are all very common behaviors in college, which is
sure.
why
Yes.
you're at a higher risk.
Yes.
And the showers, she said something about showers.
That not so much as far as the exchange of respiratory fluids. That's just a general practice as far as, you just want to be conscious. And a lot of the times, especially being that those the babies and young people and teens are most susceptible to getting meningitis. Those are all groups that aren't especially careful about, being conscious about hand washing and and
covering the mouths.
Covering the mouths and all of those things. So it's really prevalent in those age ranges.
That's good. And this is great. Immunize Nevada. I didn't even know you guys did all this stuff.
Yeah.
So that's great.
Yeah,
that's
we're
fantastic.
definitely, thank you so much for having us today here. And of course, we're happy to collaborate with Jamie and share her story at this year's conference as well. And just happy to get out this information out to Nevadans and how important it is to vaccinate against meningococcal disease. I did want to say too, there are 2 types of meningococcal vaccines. So we have the meningococcal conjugate vaccine, which is the one that's required for 7th grade entry.
Okay.
That's ACWY.
Right.
That's going to be the most common recommended vaccine by your healthcare provider.
Okay.
In Nevada, since the school mandate was introduced in 2017, we've been doing a pretty good job of getting our rates up. Right now, we're right within the mid 80th percentile for vaccination coverage for our adolescents. Which is good. We still have a ways to go on that. The school mandate has definitely helped us in that regard. So we're happy to see that kind of upward trend and then hope that it continues to grow. Yeah. And then we have the Men-B vaccine, which covers meningitis serotype B. It is another rare disease, but is the type of meningitis for all the college outbreaks is meningitis B. So,
and that's the vaccine that is actually not recommended.
Right. So it's on a tier 2 recommendation.
Right.
So it's not for special populations, but all of your college outbreaks have all been associated with meningitis B. So important to make sure that your child is fully immunized against both types with both vaccines. That's what we're out there in
Yeah.
the community trying to educate everyone about. It's just the importance and the seriousness of this disease, and something that's so very preventable, as Jamie had mentioned.
Absolutely. So let's see, I lost from an insurance standpoint, are these 2 vaccines covered? If the
Under
physician,
most private and public health insurance plans, yes. So I would, as a consumer, make sure that you're contacting your individual health insurance provider to ensure that they are. Meningococcal being the Meni-CWY school-required vaccine is by and far covered by most insurance plans. And for the vaccines, under the Vaccines for Children's program, which
It's amazing.
make sure, that children that are uninsured or underinsured have adequate access to vaccines. So that is widely available. Men-B vaccine is a little harder to access, and sometimes there's a little bit of reimbursement issues that are associated with that. But Southern Nevada Health District here in Las Vegas does supply it, and is a great partner of ours, and would be an
Wonderful.
excellent resource and a place for people to go.
Okay.
If your individual, primary care practitioner or pediatrician doesn't carry it.
Yeah. Okay. Well, thank you for that.
Yeah.
Brianne. All right. We actually have a couple of members of our board of directors here with us today from Moral Support, and who I think they may have a little bit of comment to give about. I know that we have Chrissy Sampal here, who's our board advisor, and Vida Braganza, who is our PRO. Do you have anything to say, ladies, just real quickly?
Well, first thing first, thank you so much for having us, and it's an honor to meet Jamie and the group here. We are so honored because the information is really powerful, not just from a personal standpoint, but from a public standpoint. And meningococcus is very near and dear to my heart because my younger son, who was 12 at that time, contracted the disease, and he is one of the lucky ones that made it to the 80% survival, because he, knock on wood, he did not have any kind of adverse effect from the disease, and he's functioning normally. The concern was the hearing, because that was the pediatrician, the ID doctor said, but they tested him, he was fine, and I think it's there's also the timeliness of treatment, because the bacteria, the more timely you provide the antibiotics, because it mimics some of the symptoms from a childhood, some of the childhood diseases. It's kind of hard, it's very tricky, and I'm so thankful that Jamie is here sharing our stories, and then for the public, that they would have more awareness, and so that they will be more proactive in providing that immunization, which is preventable. I mean, the disease is preventable if I had only known. And I'm going to ask Miss Brianne, sorry, it's my senior moment, about the lifetime immunity. You know how the vaccines, is that a lifetime immunity? And if we miss, like from a personal, I did not have any kind of treatment or vaccine given to me as a, growing up, will it be indicated also for any kind of age group, or are you focusing on that adolescent and college group?
Sure. I'm not super comfortable speaking to the more so technical points as far as immunity goes and the longevity of that. I know that for every person it is going to be a little different. The vaccine is very effective, and the reason why it's administered when it is because that's, again, the most common age in which meningitis is contracted. That being said, and I apologize, what was the second part of your question?
The target population.
The target
Are you just
population.
focusing on the adolescents? or-
Yes, so with the school mandate, that really hones in our efforts on those adolescents within that age range of 11 and 12 that are starting their 7th grade year. So that's where our efforts are primarily concentrated as a coalition. Obviously, you would work with your healthcare professional should there be an outbreak of any kind to determine whether or not you would be within that group that would be best advised to be vaccinated. But right now, as the recommendation stands, it is an adolescent series recommendation.
Okay.
I mean, if you think about it, in 7th grade, everyone's in sports.
Exactly.
You know, I'm like thinking about the locker rooms just in a sense of like, and everyone's sharing water bottles without a doubt.
Yeah.
And then if you think about college.
Yes.
Yeah.
And, you know, we're all trying to be independent and we're really not thinking about taking care of ourselves. That's the last thing we're
That's
thinking
great.
of. So,
Yeah.
exactly. So it's important around that time just because those social behaviors and sharing germs or the droplets that you were mentioning are so higher. They occur more often around that time.
Okay, good. Well, thank you for that. Vida, do you have anything to just add a little?
All
little
right.
bit?
First of all, I just thank you, Doris, for letting me know to come here because I had other plans, you know. And I said, oh, I better go. This is God's call. So for Jamie, you are an inspiration
Thank you.
to many, especially the young kids out there, the college students and 7th graders and all that. You know, your advocacy for this meningococcal disease prevention is large by far. It's really large. I can share, I have my own advocacy also. I'm a breast cancer survivor. And the awareness of, you know, preventing cancer, preventing these kind of diseases is very, very important. And I also have a question. I did mention earlier about the mortality rate of this disease. Have we touched on that at all?
Not yet. I will
Okay,
later.
all right.
Right now,
Yes.
the current statistics are 21% on the general overall. But with other types, I think it's a little higher than 21%, correct? I think that was in your website where I got that.
I do know that you can reference
Yeah.
meningitisb.com for more information.
Okay.
For the viewers out there that want to look any information up too on the disease.
Okay.
And also being a patient myself, you know, undergoing chemotherapy and breast surgery and reconstruction and all that, I, you know, could feel your pain,
Yeah.
you know, being in the hospital all that time, because I did have a period of depression myself.
Yes.
So, you know, for everybody there who's listening, this could be prevented, so please take action.
Yes,
Absolutely.
exactly.
Thank
And
you,
I,
Vida.
I just wanted to touch upon that point as well, being a cancer survivor and undergoing cancer treatments and being immunocompromised as well. We focus a lot on that as a coalition, that getting
Right.
vaccinated is not just about you.
Yes.
It's
Yeah.
about protecting those around you who are
Exactly.
too young
You
or
are.
too old or especially vulnerable against getting those vaccine preventable diseases, meningitis being among the
Right.
most
Right.
serious.
Thank you.
My
Yes.
friend, she has cystic fibrosis, and luckily had her lung transplant. But she has a 3-year-old or 4-year-old boy, and if her son brings over a friend who is not protected, I mean that is a severe case for her, you know. And if I may touch on this, you know, I obviously agree that protecting yourself when you can is the best option, right?
Correct. Right.
Because when you learn you have meningitis, it's very different when it comes to cancer, because cancer is obviously a very tough journey, right? But for meningitis, there is no moment of having time to realize what you can do, because when you are learning you have meningitis, you're in the hospital wondering if you're going to survive the next day. And the best way to do that is to protect yourself.
Correct.
So please talk to your doctor and ask about those 2 different vaccines.
Yes, absolutely. Those are all good messages. Thank you so much, everyone, for all your input. And so, Jamie, what are your plans for the future?
It's always to advocate and to educate anywhere that I can. Those are my 2 most important things. My goals are to always testify in as many states as I can that are touching on the subject of vaccinating for meningitis. It's just so important. And because a lot of times, like how I was, I didn't know anything about this disease. So when we're in there in that room testifying, like, yes, all of us in this room is very educated right now about this disease. But what about the millions of people in this state outside of this
Exactly.
room?
Exactly.
We want to get them the opportunity to step in and to learn about this disease, because if there was a law, a mandate where we had to get educated,
Very
then
good.
that would have been an obvious decision for us to protect ourselves from this disease.
Very good.
So, what were you saying one more time? Where were we touching
that,
upon?
yeah, no, this is, I was asking what your plans are for the
Oh.
future, but obviously you also said something about what your message is to the public.
Yes.
So,
To advocate, to educate, my goals are to continue to testify in other states.
Yes.
My dreams are to see all states to be on the same page as us and follow ISEP
Exactly.
regulations,
That's
and to
wonderful.
make sure that everyone's protected when they go into any chapter of life.
thank you for that. And
add a little bit.
Sure.
Because the Philippines right now, because I have Filipino channel, I'm very much. They are having a lot of cases of meningococcemia, the real deal, and of course, third world country. It's kind of hard to push for budgetary, financial concerns.
Right.
But there were several deaths already. So it's very timely. That's why I said, "Oh my God,
We gotta
what is this?
disseminate
It's so
this
coincidence,
information. Yeah, yes.
But the information, hopefully, because like what I said, information is powerful, knowledge is powerful, and if people, the ignorance, some people, it's not intentional that they don't
Right.
get, but they don't know the importance.
Exactly, they don't know.
So, I like your advocate and educate. Thank you.
And I wanted to just add one more thing and credit to Jamie as well. It's stories like hers and stories like many like hers that have helped shape legislation at the state level for Nevada as well. I just wanted to add that in addition to the 7th grade mandate for the first meningococcal vaccine for that conjugate vaccine, we do have a university requirement as well. So that's for the University of Nevada, Reno and the University of Nevada, Las Vegas. Both require that you have the first dose of MenACWY too. So we're trying to hopefully move towards the meningococcal B vaccine too.
Fantastic.
We're making incremental changes, small steps at a time, largely due to the efforts of Jamie.
that's good. And that would be your message to the public from an immunized Nevada standpoint then?
Absolutely.
Yes.
I would think that just more so touching upon or reiterating what Jamie had said is that this is not necessary.
Yeah.
We don't have to have people suffer the ultimate consequences of meningococcal disease when we have 2 vaccines that protect against it. So if you have any questions, if the public has any questions, please visit immunizenevada.org.
Yes.
And we are happy to provide you with resources, and you can also call us.
Oh, amazing.
And we'd be happy to answer any questions that you have about the vaccine as well.
Okay. Well, on behalf of the PNANV and PHLV Radio, I would like to thank you, Jamie, and Brianne, and David, actually, of Immunize Nevada, for allowing Filipinars to conduct this interview. Jamie, thank you so much for telling us your compelling and inspiring story.
Of course.
There is actually a Finnish word, Finland word, or a trait. It's called SISU, S-I-S-U. I actually work for a healthcare company that has that credo. And SISU is a trait that encompasses the strength of will, determination, endurance, tenacity, and perseverance in the face of adversity. And you are the personification
Thank you.
of that trait.
That's very nice.
Thank you so much for your inspiration. And to Immunize Nevada, thank you for facilitating this interview. Thank you for all you do for the community. And like Brianne said, if you have any questions about immunization, you can go to www.immunizenevada.org. Okay.
Amazing.
And for our listeners and followers, whether you are in the healthcare field or not, we need to be reminded that meningitis is deadly. Like we said earlier, the overall mortality rate right now is 21%. And while most people recover from meningitis, there are permanent disabilities such as brain damage, hearing loss, and all that kind of stuff that can result from this infection. And vaccination is the key to help prevent this. So please help advocate for this. Share Jamie's story. And thank you very much for tuning in to Philippine NARS. This is Doris Bauer, your host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine NARS, news and features about the Filipino-American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.